The study was run out of the SEER database, which is this NIH program, but I don't think we should get too worked up about it quite yet. If you looked at the actual numbers, say you're a patient between the ages of 20 and 29, the chances that you were going to develop colon cancer in any 1 year in 1985 was 1 in 200,000, which is a pretty small number and a reassuring number. The chances that that same person will develop a colon cancer in 2015 is 1 in 100,000. Well, that's still a pretty small number, but it's twice the risk of somebody from 30 years ago. To an epidemiologist or to someone who's interested in this study, that's a big number. Simple things that we know are not great for us, increase the risk of getting colon cancer. Smoking, drinking too much, a sedentary lifestyle devoid of exercise, all those things are an increased risk factor for colon cancer. What I tell patients with respect to screening is the same thing as the federal government tells patients with respect to screening, which is when you turn 50, you're supposed to get that colonoscopy. Now, that's not a hard and fast rule. There are patients who have a family history or who have certain genetic conditions which they'd be aware of long before the age of 50, and that might mean you need to get in sooner. Colonoscopy is very safe. You go to sleep for about a half an hour, and then you're sure of not having the same risk of developing colon cancer as someone who didn't get that screening test. If you have abdominal pain, unexplained weight loss, if you see any blood in your stool, or even a change in bowel habits where you're becoming constipated or developing diarrhea, would be things worthwhile discussing with your physician. I guess the number one thing is follow the recommendations that have been generated by the federal government. The other thing I would say is if you're a young person, the news from this study is still pretty good. Your risk of developing colon cancer is really small, but it's not zero. So as we talked about, you have to be aware of what's going on with your body. You have to take it seriously, and you have to seek consultation with a physician. And the third thing is we have seen a big drop in colon cancer rates over the past 20 years. And a lot of that's because of the investment that we've made as a society in getting these screening regimens sorted out and in people participating in the screening regimens.